So today we are going to talk about the different types of hair loss. We have Dr. Hassan Aziz here with us. He's the lead dermatologist in Kings and Queens Hospital. So we'll discuss about the different types of hair loss and the best way to treat them. So thank you so much for Dr. Hassan Aziz to join us. So if you kindly could take us through the different types of hair loss.
Thank you for having me on your show. As dermatologists, we divide hair loss into two kind of hair loss. First of all, it's scarring alopecia. Scarring alopecia is the kind of hair loss. Once you lose your hair, you can't have them back, or the hair follicles do not grow back on those areas. There are different kinds of scarring alopecia, which I think should not be discussed here because it's very medically oriented, and I think you should see a dermatologist so that we can first of all do a biopsy and then do the right treatment for you because this is quite an extensive treatment. As far as the non-scarring alopecia is concerned, I personally divide them into immune mediated and non-immune mediated alopecia.
And can you please tell us what are the different types of immune mediated hair loss?
So in the immune mediated hair loss, it's alopecia areata, and we divide alopecia areata according to the area or how much the body area or the surface area is involved. It's mainly immune mediated, and it comes with other kind of immune conditions that we normally test, like thyroid problems or joint problems as well.
So it's very important for a patient who all of a sudden notice a bald patch in the middle of their head, that they should not ignore it. They should consult their doctors to rule out if they have got any other underlying autoimmune condition, where autoimmune means where your body is attacking your own cells. So they should consult their doctors that is it only just the alopecia areata, or there is any other underlying immune condition as well. Thank you so much for adding that. So now if you could kindly tell us about non-immune mediated hair loss.
So the non-immune mediated hair loss, again there are many types. The most common we'll discuss today is called male or female pattern hair loss. This is mainly because of the hormones, which is the male hormone, which is also in the females as well, which is called testosterone. And because of that, people lose hair in certain areas, in a certain pattern. So the treatments are varied. And we can treat it according to what the patient wants and how quickly they want it back.
Right, okay. So what are the best available treatment you will suggest to the patients?
So the best available treatment I would suggest is obviously patients can have topical minoxidil, they can have oral minoxidil, there is oral finasteride or dutasteride, which is testosterone lowering medication. It has to be given under supervision of a doctor, especially because it can have certain side effects. And the most safest I normally recommend to a lot of my patients is PRP. And it's a brilliant treatment. I've seen outstanding results with it.
Absolutely. So PRP is full of growth factors, which is prepared by taking your own blood and then spinning that in a very specialized machine to get the maximum growth factors, and then those growth factors can be injected into your scalp to basically rejuvenate the hair follicles so that they get stimulated to make your hair thick and regrow your hairs as they were when you started losing them. Now, I was just wondering, how many sessions do you recommend them?
It's very varied. Once you see your doctor or your dermatologist, they will decide upon how much area is involved, how much is the thing is there. Normally people would need 3 to 4 sessions at least. And I think this is a continuous process. If at all, you should at least have it done twice a year at least if you have thinning, because it's a continuously rejuvenation and providing the right nutrients to the patient. It can be concurrently done with the exosomes as well. So exosomes,
very upcoming treatment nowadays.
Yeah.
We are
So-
doing that quite a lot nowadays. So,
Yeah. Well, what kind of results have you seen with exosomes?
Excellent, beautiful. People
I
are
totally
loving it.
agree.
Yeah, because exosomes are basically vesicles which increase the communication between the cells. So on top of PRP, where we are injecting the growth factors, we add the exosome so that we improve the communication between the cells. So they basically, when it happens, a live cell basically wakes up the dying cells. So this is how it works. Now there is another interesting thing which is getting very popular: hair transplant.
Yeah.
So people think, I think that once they have their hairs get transplanted, that's it. So if you could tell something useful for those people, that would be really good.
So once you get your hair transplanted, you need to take more care of these hair. They are even more fragile as compared to the original previous hair that you had. First of all, take regular supplements. Some of the supplements we can tell you if you directly contact us or DM us, which are really good. We can tell you about those supplements. Next, choosing the right shampoo, which is not too harsh, having right sleep, and having PRP. Again, why I don't know why we're coming back to PRP, but it's I love PRP.
Oh yes. We are seeing many patients after having hair transplant and who had PRP, and basically their results they get enhanced. So because the implanted follicles they get stimulated much more faster in the transplanted area with the help of PRP, and then on ongoing basis, if they are basically having the PRP sessions that basically keep their hair follicles very stimulated and rejuvenated and healthy, I would say.
Yeah, that's very important, and along with that, exosomes obviously will help, like we discussed before. And taking good care of the scalp health, not having any dandruff and all these things is very important. Choosing the right shampoo and product is very important. So do consult your doctor and your dermatologist for the right products.
Right. Okay. And the most important thing is this, that lots of clinics they are providing the PRP treatment, but not all the PRPs are the same. The things which matter most, which kind of equipment has been used to prepare that PRP, which kind of machine has been used to prepare that PRP, because not all the machines make the same kind of PRP. There's big variation in the formation of PRP. So please make sure that the clinic you are going to have the PRP session has got the best machine, so that when they are making the platelet-rich plasma, it has got the maximum number of growth factors which are useful for your hairs.
Actually, I'm quite impressed by the PRP machine this clinic has, and I've seen brilliant results with this machine, and I would highly recommend all my patients, friends and families to have this PRP done, especially with this machine, given the right amount of the active ingredients that it gives to your scalp and hair follicle.
Well, thank you so much, Dr. Hassan Aziz, for joining us today. If you have got any questions for Dr. Hassan Aziz about hair fall or about any other skin related conditions, please contact us. Dr. Hassan Aziz will be very happy to answer your question, and we will be very happy to help you out.